watching India Today.
We should have a transparency in terms of rates, types of medicine, diagnosis and all. Relative of the patient, they don't get a clear message from the doctors like what kind of diagnosis is required.
If you compare it with the international standards, where there is even in an ICU, there is a 1:1 ratio. Whereas in Indian healthcare, it is 1:15. That means one nurse or one doctor for 15 patients.
Most of the people are not aware of the health benefits, okay, especially with the rural region where the penetration of the insurance as an industry is very less.
Indian healthcare industry, which stood at $61.79 billion in 2017, is plagued by multiple issues. While the existing infrastructure is not enough to meet the growing needs of the population of the country, there is also inadequate outlay for health. According to the National Health Policy 2002, the government contribution to health sector constitutes only 0.9% of the GDP. In India, public expenditure on health is 17.3% of the total health expenditure, as compared to 24.9% in China, 45.4% in Sri Lanka, and 44.1% in USA. To make matters worse, lack of quality, low penetration and high prices of medicines and healthcare services, along with absence of affordable alternatives in the country, force high out-of-pocket expenses. Lack of transparency in healthcare services and products exacerbate the problem. Patients rarely know the real cost of care until after they've received it. As medical service consumers become more involved, conscious towards their healthcare upkeep, and take on more responsibility for paying for it, there needs to be a major push for more transparency in the industry. The Indian consumer today faces high deductible health facilities, and increasing skyrocketing medical expenses demand cost information, quality, and information on affordability as well. Access to information regarding the quality and cost of healthcare services can inarguably help consumers make better decisions about their care. Increased transparency will drive positive patient outcomes and greater patient satisfaction, ultimately uplifting the health of all Indians.
If you look at number of available doctors in India, it's around 7 per 1,000 people. Right, and which is abysmally low. If you look at Japan, that number is around 21. Right, if you look at number of beds available per 1,000 people, it's around 9 in India, which Japan should be around 120, 130. You know, those kind of things. So obviously, infrastructure is one is lack of infrastructure. That's one. Two is the quality of infrastructure as well.
Meddco.com is the answer to most of your healthcare-related woes. India's first digital pricing online platform in the healthcare sector, Meddco is an aggregator which provides healthcare services with dynamic pricing, online doctors' OPD appointment system, and information on free health camps across the country. The three pillars of the service are price transparency, offering clear prices of specific treatments in hospitals; Affordability. Users can choose from options of cost-effective healthcare services. Availability. Offering healthcare options near your location.
Well, Meddco has this SaaS-based product offering where we onboard hospitals who are looking to increase their visibility. And our platform offers such provisions wherein the hospitals can come across and they can list their medical treatment packages with us. What it happens is the consumers, the healthcare consumers who are looking for a good amount of information based on the surgical packages and their pricings and the cost that they're going to incur, if they can find this information on their platform, this is how we deem ourselves helpful to them.
Meddco has partnered with more than 1,000 healthcare providers who offer fixed-price treatment packages. Patients looking for treatments can search, compare packages, and can make informed decisions regarding treatment expenses well before opting for the treatment.
My father was having a severe pain in the abdomen, so I just got the things checked up and all, and it was diagnosed with the appendicitis. So I was in very much tensed like how to take care of the expenses and all. So it was very much difficult for me. So I just have a nearby hospital beside my house. So I just went there casually and got to know about the cost of a particular surgery, but it was not at all affordable for me as I belong to a middle class family. So basically what I did, I just went through online and suddenly I got to know about Meddco.com, which proved to be very much beneficial for me as I could, like sitting at home, I could make a comparison from among 10 different hospitals and I could select a best one that suits my pocket.
Meddco's online platform helps locating a doctor based on specialization in your selected area in real time when you would like to consult them. Not only do you skip long queues and waiting times at a hospital by booking an appointment on Meddco.com, you can also avail information about a doctor's consultation charges, their availability, qualification, user ratings and location.
रिसेंटली मेरे पिताजी को पेट में दर्द हुआ और डॉक्टर से कंसल्ट करने के बाद में उन्होंने बताया कि उनको अल्सर का प्रॉब्लम है और सर्जरी जो है वो मुंबई के बड़े हॉस्पिटल में करना पड़ेगा। तो मुझे बहुत डिफ़िकल्ट फील हुआ मुंबई जाके सर्जरी करवाना मेरे बूढ़े पिताजी के साथ में। तो देन आई सीन द पोस्ट ऑफ Meddco.com ऑन सोशल मीडिया। सो Meddco.com का वेबसाइट सर्च करने के बाद में मुझे पता चला कि इंदौर में ही ये अल्सर की सर्जरी पॉसिबल है और कम प्राइस में। तो देन आई कॉन्टेक्टेड द सेड हॉस्पिटल और वो हॉस्पिटल ने कंफर्म किया कि अल्सर का सर्जरी इधर ही हो सकता है। तो मैंने सर्जरी उधर ही किया और मेरा कम प्राइस में भी सर्जरी हो गया और जो ट्रैवलिंग का एक्सपेंसेस और हेडेक था वो भी मेरा बच गया।
Meddco allows the user to search for surgical procedures, diagnostic tests, and other healthcare services amongst various hospital and healthcare providers in and around the location of the user to compare the prices of those services, compare the quality of services by the user rating or reviews to help them make an informed decision.
From some known sources, I came to know about Meddco. .com, and in that there is a very good thing that they are providing us different hospitals with different budgets and at a cheaper rate, half the rate we can get this treatment done, and it's very good, and everybody can avail in future this app, and it will be very useful for them also. I hope this will go further.
Apart from the regular healthcare services, Indian healthcare consumers face acute shortage of timely emergency medical services as well. The major challenges related to this sector in India are non-availability. There has been an increasing trend in the number of deaths caused due to unavailability of timely medical services. No transparency in transportation costs. Costs for availing emergency medical services have increased enormously over the years. No ETA or real-time location information after booking ambulances.
Unlike the Western world, in India we don't have a centralized emergency, medical service number, right? Some people call 108, some people call 102, those kind of things. So one, there is lack of it. Two, I think there is lack of awareness about it as well. If I'm traveling from Bombay to Bangalore and I come up and I need a emergency service, I don't know what number to call. I'm not even sure about whether I will get an ambulance if I call or not. So one, there is no accountability. I think 100% of emergency cases in India needs to be documented, and there has to be a tat on it in terms of, saying how much time did the ambulance take to reach, the spot.
Meddcoambulance.com is India's first emergency ambulance aggregator service which integrates city emergency ambulance transportation for patients and ambulance drivers as their partners onto a mobile technology platform. Aggregating emergency ambulance assistance across the sector not only helps in saving time in the crucial golden hour of trauma, but also reduces the costs.
That whenever there is a road traffic accident or any emergency things, you should definitely go with ambulance services, because ambulance services have a lot of facilities. It's our top priority that before shifting to hospital, patient will be in well condition.
Based on live location tracking system, users can book an ambulance instantly by using Meddco Ambulance app available on both Android and iOS. All you need to do is press the emergency button and the app connects to the nearest available ambulance around your location. One can use this on location or even book it for someone else in a different area. The app offers the following features. Easily book emergency ambulance with a press of a button. Convenient to use and find an ambulance near your location for elective or emergency booking. Track ambulance on GPS-based maps with real-time estimated arrival. Choose a free or paid ambulance available near you. Cost estimation depending upon distance travelled and choice of ambulance made. Various hospitals, clinics and NGOs organize health checkup camps to help prevention of common diseases. Meddco helps users find such preventive health checkup camps near their location. With price transparency being the key, Meddco has helped rebuild trust with patients, consumers, physicians, hospitals and healthcare insurers. It has played a pivotal role in optimizing costs and bringing efficiency in sourcing and streamlining the healthcare supply chain. Even hospitals have benefited with associating with Meddco, as an increase in customer satisfaction results in better results and relationship.
From the time we have been associated with Meddco.com, mass public are getting to know about our treatment facilities, our pricing, which are comparatively much lesser than the normal nursing homes also in those areas. And even Meddco.com is generating a positive image for our hospitals, and it is trying to overcome the dissatisfied feedbacks. Basically, the dissatisfied feedback is only of the pricing factors in the private hospital. It is never being for the treatment.
You are watching India Today. You are watching India Today.
Being India's first digital pricing online platform in the healthcare sector, Meddco is certainly a remarkable and promising innovation. Let us listen to Dr. Paul, founder of Meddco.com, for further insights into the brand.
Hello and welcome to our show, Dr. Paul.
Thank you, Prachi.
Let's start from the beginning. How did the idea of establishing Meddco come to you?
I see the patients, whoever come to the hospital, they mostly, before reaching to the hospital, they have the only concern ki, do you have this facility in your hospital? First thing. Okay, and the second immediate question is how much that would cost me. So I've been seeing this constantly in last 11 years of experience. This is the two things what motivate the patients at the first stage. And this is potentially, I'm talking about the middle class population, middle class, lower middle class, and little upper middle class people. Because these are the people who pay in cash. Okay, so they wanted to know what is the price before they reach to the hospital. So continuously these situations are coming to me and observing these situations. So I find there are a certain gap in the healthcare industry, and this is probably the transparency part, the awareness part about the price, and the availability, of course. So there the thought come in my mind, why not fill that gap, what is persistent in the healthcare industry. Then this Meddco.com concept has arrived, where users and doctors, means hospitals, providers, we call them providers, they both can come together and create a system of transparency. If you see Indian healthcare industry, okay, the most of the customers, they are paying by cash. They are not insured like in the Western countries where most of the populations are covered under the insurance scheme. So here patients need to pay in cash, and they need to pay it immediately with the treatment. As the industry in India is not yet organized, when we call it as the pricing part, that means the price of a service in one hospital is sometimes varies in multiple times in other hospitals. Means there is a gap of standard pricing.
Could you elaborate on the features of Meddco?
Well, at Meddco we have two products, means two IT services what we provide. One is Meddco.com and another is Meddco Ambulance. At Meddco.com we categorize into three different service areas. One is called package comparison. Other one we have for online appointments of doctors, and third one is health checkup camp. Now all these three services what we provide, these are quite unique. The first one, the package. Now in the package sections, a user, what he does is, if he's searching for certain disease or if he want to avail certain treatment, he can come down to our website and click on the package portion. There he just need to type the surgery or the test or any other healthcare things what he is looking to obtain in that section, and choose the area where he want to have the service. And what our website does is, it searches all the hospitals who are listed in that area, who provide the same surgery and the price in the different bed categories. Now we have, in our software, we have three bed categories where the hospital list or update their packages. One is general bed, one is twin sharing, one is private room. So the user could see the prices in all the three categories and of different hospitals, whoever is providing the service, and then choose the best one. The second part, that is called appointment. Nowadays there are various websites who provide online appointment things. At Meddco we thought let's give this platform free of cost to the hospitals. So this appointment section is free of cost for all the hospitals who are on Meddco board. They can list their doctors, n number of doctors, with their availability, what time they are available, and the charges. In our website, everywhere we have ensured that the charges related transparency should be posted, placed properly in our website. Third section, which is the very unique of our website, is health checkup camp. I'll tell you, there are various organizations in our India who does free health checkups periodically, monthly, weekly, bi-monthly, but many of us, we are not aware about it. What we are doing is we are giving a platform to the hospital and various NGOs also
They can come also and can register with us. They can publish their health checkup camps with the specialty, with the test they are doing free of cost or the subsidized cost, and the location where the camp is. So what happen, once they register it, our user get a notification, whoever around the vicinity, they automatically get a notification. Another service product that is we have at Meddco is Meddco Ambulance. This is clearly like any taxi booking app, but with some extra features. Now in taxi booking app, what happened ki somebody just book the taxi, the charges are fixed and they pay that amount. In ambulance sector, it wasn't that easy. In ambulance sector, there are ambulance who are ready to follow standard rates. There are ambulance people says, no, will not follow these rates, as we get patient only for one way, other way we do not get patients, hence we will have our rates. And there are ambulance who offer free of cost. Now all these three sections are, we wanted to target all these three sections to be in Meddco Ambulance. So we have developed the app accordingly. Now in our ambulance app, even the ambulance who are ready to opt the standard Meddco rates, they can opt it. They want to follow their own rates, they can list their rates, and the ambulance bill would come according to their rate list, what they have updated it. And the ambulance who would like to offer free of cost.
Dr. Paul, certainly Meddco is a remarkable innovation in the healthcare sector in India, and you've received tremendous response from the public. How have the hospitals reacted to it?
Let me tell you, we have been getting very good response from all sectors, all the areas, like some cities like Mumbai, Ahmedabad, Chennai. They have responded so well. We have more than 7,000 hospitals onboarded right now.
What are the major challenges that you faced while establishing Meddco as a brand?
In all the areas, the major thing is to bring them into the zone of transparency. To explain the hospital, set up packages. Now, at Meddco Ambulance, we have a tremendous difficulties because ambulance sector, it's not like a taxi sector, as I said earlier. They get one side fare only. That's the most difficult part. Now, if a patient say, I'll be traveling from one zone to another 55 kilometers away a hospital, that another 55 kilometers he has to come empty. So we also need to see that part. Yes, these we cannot help the ambulance. But yes, with our app, there are features where the ambulance, wherever they are located, they get a leads of that part only.
Thank you so much for talking to us, Dr. Paul.
Thank you so much.
You are watching India Today.